say hi to all participants and the guests in this meeting. Am I audible to all participants?
Yes, yes, you are audible.
Okay, thank you. Uh, First of all, I would like to thank you, Mr. Durgesh, and my other colleagues in Indian Psychological Society for inviting me and giving me this opportunity to express my feelings, my knowledge, and my experiences in Iranian background. As you mentioned, I am working in International Association for Cross-Cultural Psychology and also in Asian Association for Social Psychology as representative at large, and I'm working as a representative for Middle East region. I also am international representative of Iranian Psychological Association. So I provide a report from things have been done during pandemic of coronavirus within the last few months. And I think we talked about mental health issues in this session quite enough, and I get too much information and very good information about my colleagues, and I would like to thank you all of them. I am going one level upper and would like to talk about policymakers, governments, NGOs, and other bodies in the societies, mainly in the Middle East, and review their activities during this pandemic, because their activities are crucial, I think, in the managing mental health issues among population. So I think we heard good stuff about what mental health is and which aspects it has. And in this sense, I would like to give my report about what happened in the Middle East during the last few months. I think it might be interesting for you as our Indian colleagues to know what is being done in my region. I collect this report from almost 8 countries, and I would like to give this brief report. And first of all, I would like to say that I have a good news. My report is too short, and I don't want to torture you as last speaker. We all know about coronavirus that has become the most prevalent issue these days. It has not only the immediate physical effects, but also the variety of psychological consequences. All parts of the health systems play their role in this novel crisis, including but not limited to psychologists. Clinical as well as social psychologists in the Middle East have all been involved in the mental health services provided for affected and non-affected individuals. As we know, most of our affected people are their families, and they have lots of stress during their disorder time. So this report summarizes the main activities have done by psychologists in the region, with main emphasis on Iran, Georgia, Turkey, and Arab Union, with the most influence and impact on Lebanon. Well, I'm starting with my own country, Iran, which I'm living and working there. There are 4 bodies in my country that provide preventive and interventional activities about COVID-19 pandemic, which are Iranian Psychological Association as the biggest and largest non-governmental organization in my country with more than 26,000 members. And we have Psychology and Counseling Organization of Iran. Also, we have Ministry of Health and the Welfare Organization as an old body who cares about responsibilities about mental health issues in the country. The main themes of activities during the past 3 months were providing online counseling service free of charge by volunteer psychologists and counselors. I hear that, and I get the report from my colleagues. More than 1,300 psychologists participated in this program in my country. And they used several hotline services. I named them as 4030, 1480, and 137 as hotline for emergent interventions. Also, the development and sharing useful content about self-help guidelines to cope with several aspects of COVID-19 pandemic. And another activity was the implementation of several webinars like this and conferences regarding stress management during coronavirus situation. And me and my colleagues were part of these webinars and conferences. We talked about mental health issues and stress management or conflict resolution strategies, as my colleague mentioned in one of the presentations, work family conflicts. And we also talked about these conflicts in my country. But in Georgia, we have different settings and different activities. There are a few organizations and NGOs in Georgia which have performed several supportive programs during COVID-19 pandemic. Global Initiative on Psychiatry is a charity, is an NGO organization for psychiatrists, and they initiate good plans for raising mental health issues in the region of Caucasian. So the GIP Tbilisi and Georgian Society of Psychotrauma are the most active ones that have held regular webinars on COVID-19 and mental health. So crisis counseling services for current circumstances and affected individuals in online and phone call formats was the main issue in Georgia. My colleagues noted that they visited much more patients there, and they had continuous seminars and workshops on psychoeducation about coronavirus, stress management, and burnout prevention, which is a very important issue for workers. Uh, Also, research on COVID-19 crisis, impact on mental health and well-being, and other psychological services in the society. And I will report one report me and my colleagues have done about coronaviruses. I will give you a very short report after this part. But let's go to Turkey as our neighbor country and one of the most successful countries in controlling coronaviruses. Uh, from the first days of pandemic situation in the world, Turkish Ministry of Health, in collaboration with psychological and psychiatric associations, started to provide supportive programs for clients and patients using phone calls and online services. 24 hours in 7 days. Within these programs, each psychologist and psychiatrist provide professional support to individuals 2 times per week for about 2 hours each time. And it's all for free. They also used several applications for full-time connection with patients to collect information about their health situation during the pandemic. In addition to these efforts, the Ministry of Health continuously supports all participants and members of healthcare systems across the country. And the last part of my report is related to Arab Union, which are about 7 countries, namely Lebanon, Jordan, Saudi Arabia, and other countries. They have a society for Arab Union, who is a large region of countries which provide several and different supportive programs for their people. Like other parts of the world, the social media and networks play important role in the preventive and awareness-raising programs during the COVID-19 pandemic. These programs include, but not limited to, several live speeches about how to cope with stresses during this crisis situation, webinars on self-help activities against um, several mental health conditions during the COVID-19, online counseling services to different people from affected ones to non-affected, and also designing and implementation of research about the psychological and social impacts of the pandemic. Well, as seen in most countries in my region, psychologists and counselors have played important roles in raising awareness about how to overcome several distresses during the pandemic. And they showed up in media to explain how our body and mind respond to stress and how to cope with them using psychological and psychiatric guidelines. Well, many departments of psychology in my country try to establish online surveys and interventions for individuals from the first days of the pandemic to recognize more precise knowledge about the novel coronavirus disease, to be able to provide more effective and reliable therapeutic interventions. And I would like to refer to one of these studies I've done in my university and my city. But before reviewing this paper, I would like to thank you from my colleagues to provide this report. Professor Sharifi from Iran, Professor Jabakhishvili and Makhashvili from Georgia, Professor Chikrikjili from Turkey, and Professor Michel Naufal from Lebanon. Well, our study referred to the psychological issues related to coronavirus situation and its stresses like personality factors and neuroticism and extraversion. We found that these two factors are very important in feeling distress during coronavirus situation. And also these personality characteristics have indirect impact on coronavirus distress using risk perception and also anxiety sensitivity as mediating factors. Well, we know risk perception as the subjective judgment that people make about the characteristics and severity of risk. The phrase is most commonly used in reference to natural hazards and threats to the environment or health, such as this pandemic situation. And also anxiety sensitivity refers to the fear of behaviors or sensations associated with the experience of anxiety. Bodily sensations related to anxiety are mistaken as a harmful experience, causing more intense anxiety or fear. For example, a person may fear the shakes as impending neurological disorders. Well, we see that many psychological factors play a role in the distress affected by coronavirus situation, and we need to explore more these researchers to find out what is going on under the stress situation caused by coronavirus. Well, I think it would be enough for me for this time, and I will be very happy to answer any question or any comments about my presentation. And I would like for you to have a healthy and safe situation in India from coronavirus situation. Well, thank you so much.